Marie Snap had a bit of a shocker after her cosmetic treatment in Glasgow left her with results she wasn't expecting at all. She ended up looking like she had a stroke. She went to a salon in Glasgow for some Botox and lip fillers, but alarm bells started ringing when nobody bothered with the usual safety checks or consent forms. Things got even more worrying after a few days, when her eyebrows didn't match up. Advised to see the nurse again, Marie found her situation going from bad to worse, with her face feeling weaker and weaker. Marie was shocked when she found out the so-called nurse didn't have the medical or nursing qualifications needed for such procedures. And when Marie tried to get some answers, she got blocked on social media instead. "I just never thought I would get scammed," she told STV Scotland Tonight, sharing how the whole ordeal left her not just looking, but feeling pretty awful too. In recent years, the non-surgical medical aesthetics industry has witnessed an unprecedented boom in non-surgical cosmetic procedures. From Botox to dermal fillers, these treatments promise a quick fix to achieve the fountain of youth without going under the knife. However, beneath the glossy veneer of instant gratification lies a disturbing trend that poses significant risks to public health, specifically caused by the proliferation of unqualified aesthetic practitioners. Across the United Kingdom, there are countless similar stories of botched procedures, leading to calls for heightened awareness and stringent regulation. Non-surgical cosmetic treatments have gained popularity for their minimal downtime, perceived safety, and affordability. They offer a tantalizing promise, the allure of age reversal and beauty enhancement, without the risks associated with surgical intervention. Yet, this promise is contingent upon the qualifications and expertise of the practitioner, but unfortunately, this is a factor too often overlooked by those seeking these treatments. This industry's rapid growth has unfortunately been paralleled by an increase in practitioners lacking the necessary medical training and qualifications. From beauty salons to makeshift clinics, these unscrupulous operators exploit regulatory loopholes, offering services at a fraction of the cost. The consequences, however, can be dire. Reports and studies have illuminated the dangers posed by unqualified practitioners. Complications from improperly administered treatments can range from infections and scarring to severe allergic reactions and, as tragically highlighted in this news article, outcomes resembling stroke symptoms. These adverse effects underscore the fact that non-surgical cosmetic procedures are not mere beauty treatments, but medical interventions requiring a thorough understanding of anatomy, product knowledge, and aseptic technique. The United Kingdom is at a crossroads. The burgeoning demand for cosmetic procedures has outpaced the development of comprehensive regulatory frameworks capable of safeguarding public health. Current legislation falls short of adequately addressing the qualifications of those permitted to perform these treatments, leaving a grey area exploited by those without medical credentials. In response, industry leaders, healthcare professionals, and patient safety advocates have called for the introduction of stringent regulations. Proposals include mandatory licensing for all aesthetic practitioners, the establishment of accredited training programs, and the requirement for practitioners to have indemnity insurance to protect patients in the event of malpractice. While regulatory changes are essential, public awareness plays a crucial role in mitigating the risks associated with non-surgical cosmetic procedures. Potential patients must be educated on the importance of seeking treatments from qualified medical professionals. This includes understanding the qualifications to look for, the right questions to ask, and the red flags that signal a practitioner may not be suitably qualified. The non-surgical medical aesthetics industry's shadowy underbelly of unqualified practitioners represents a public health crisis that demands immediate action. It is incumbent upon regulatory bodies, industry stakeholders, and the public to collaborate in fostering an environment where safety and professionalism are paramount. For those considering non-surgical cosmetic procedures, let the stories of those who have suffered be a cautionary tale. The quest for beauty should not compromise health and well-being. Rigorous research, informed decision-making, and a steadfast commitment to safety can ensure that the promise of non-surgical cosmetic procedures is realized without sacrificing patient safety. In conclusion, as we navigate the complexities of the modern medical aesthetics industry, let us advocate for change that upholds the highest standards of care. Only through collective action can we protect the public from the dangers of unqualified practitioners and ensure that the pursuit of beauty remains a safe endeavour for all.